Good afternoon, Hayden Peterson. I am Mihiraa. Let's begin the warm-up session. Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there so they can help me during my initial days.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Your preparation time is over. You can now start your OET speaking roleplay.
Good morning, my name is Hayden Peterson, and I'm one of the nurses here in the emergency department. I can see you're a bit uncomfortable, and I want to assure you that we're here to take good care of you. First, can you tell me what brought you to the hospital today?
Well, I had a fall earlier today, and I hurt my elbow quite badly.
I'm so sorry to hear that. It sounds painful, and we'll make sure to help you as soon as possible. Before getting into the details, can I have your name and age for the records, please?
Sure, my name is Mihiraa. I am 68 years old.
Thank you for the details, Mihiraa. Now, let's take a moment to talk about the fall so I can understand exactly what happened. Could you describe your fall in your own words?
Sure, it happened this morning while I was in the kitchen. I tripped over a rug and landed directly on my right elbow.
Thank you for explaining that. I know it's not easy to recount such an incident. Now, can you tell me a bit more about your elbow? How severe is the pain, and have you noticed any swelling or bruising?
The pain is quite sharp, and my elbow is very swollen. It hurts a lot when I try to move it.
That must be really uncomfortable. We'll check that thoroughly. Before we proceed, were there any specific circumstances that led to it? Or was it purely because of the rug?
Actually, I was diagnosed with Parkinson's disease last month, and I've been feeling a bit unsteady on my feet lately.
I see. Parkinson's can sometimes make falls more likely, but it's good you're aware of it, and we can work together on some preventive measures to help reduce the risk. Mihiraa, I'd like to summarize the information I've collected to ensure accuracy.
Okay, you may please.
Thank you, Mihiraa. To summarize, you had a fall this morning in the kitchen after tripping over a rug, landing directly on your right elbow. You've mentioned that the pain is quite sharp and your elbow is very swollen, making it difficult to move. Additionally, you shared that you were diagnosed with Parkinson's disease last month, which has been causing some unsteadiness on your feet. Does that all sound correct to you?
Absolutely, that's correct.
Thank you for the confirmation, Mihiraa. I understand how worrying this must feel, Mihiraa, but I want to reassure you that elbow injuries like this are quite common, especially after a fall. Most of the time, they aren't serious and can be treated effectively with the right care. We'll make sure you get the attention you need to help manage the pain and reduce the swelling. Since you mentioned feeling unsteady due to Parkinson's, it's important to discuss some fall prevention methods. Simple changes like securing rugs, using handrails, and wearing non-slip footwear can make a big difference in reducing the risk of future falls. We'll go over these in more detail to help keep you safe moving forward. Do you have any concerns or questions at this point?
Yes, I'm wondering what the next steps will be for my treatment.
Of course, let me walk you through that. First, we'll need to clean and assess the wound to check for any breaks in the skin. After that, a doctor will examine you more thoroughly. Depending on the examination, we may need to do an X-ray to see if there's any bone or tendon damage. We'll also provide you with appropriate pain relief. How do you feel about waiting a little while to see the doctor?
I understand. Of course, I can wait to see the doctor.
Thank you for your patience, Mihiraa. Now, before we move forward, I'd like to ask for your consent to continue with the triage care, which includes cleaning and assessing your injury. Does that sound okay to you?
Yes, please go ahead. I'd like to get it looked at.
Great. Let's get started then, and I'll ensure you're as comfortable as possible throughout the process.